Uh, Ms. Means, congratulations on your birth. As I know from two experiences, that is about the most magical time you can ever have. We know that many Americans struggle with the issues around infertility. Medical intervention often is necessary. According to the American College of Obstetrics and Gynecology, by the age of 30, fertility in women starts to decline. It gets more rapid. That rate of decline gets more rapid throughout the decade. For families like mine, where a childbirth would have been impossible without IVF, I think it's potentially damaging to widely spread a message that if only we made lifestyle changes, we too could conceive naturally. I think that the people that are struggling with infertility sometimes feel that if they only made lifestyle changes, the world would open up. And I guess my question then is, how much time should a woman of childbearing age take to self-reverse a fertility struggle that may ultimately serve as further setback to them growing their family? And I, again, say this as someone who we did use IVF, as you're aware, and it was a transformational.
Right.
That wouldn't have been possible without that. So how long should people wait before making that decision?
Thank you, Senator, for this very thoughtful question and also for meeting with me in October. I, of course, can't answer for a specific time period that someone should wait. But the broader message, which is I think one that we probably agree on, is that the American people deserve to, and I think want to, have information from medical authorities about what is possible and what the evidence shows in terms of what environmental factors are affecting these really important issues in our life, like fertility. Like we've talked about earlier, infertility is going up about 1% a year in both men and women, male and female infertility. And the key medical conditions that are causing infertility, we know are lifestyle related. Certainly that does not mean that all infertility cases can be reversed by lifestyle changes. And also, the onus is on our medical authorities to make sure Americans are seeing that information clearly and loudly and in an empowered way, and that we then use policy and medical education to make systemic changes that make those choices easier, more accessible, and affordable for Americans. And that's really my message. Patients deserve to know what the data is showing, and not just a myopic view on technological or medical or surgical interventions. They deserve to know the breadth of the spectrum. And from working with thousands and thousands of both levels members and also in my clinical practice, I believe that people don't feel discouraged by understanding what the evidence-based levers are for how they can impact their own health. I think they're looking for that right now, and it's a yes and answer. I think IVF is miraculous. I think it should be widely accessible. And with that said, I also think we need to give patients the best public health information about what is impacting these conditions that are plaguing our population.
Let me switch tack here and talk a little bit about autism, because obviously I don't think we definitively know what causes autism. I think we agree on that, and certainly I applaud any fact-based effort to get a better understanding of that diagnosis. You've stated that the cause of autism is very likely to be multifactorial, and anyone who claims to believe that it can be just only one factor is mistaken. So I guess the question is, are those who believe autism is singularly caused by vaccines, including some of those currently serving at the Department of Health and Human Services, by that calculus, are they incorrect?
I can't speak for every person who's made a comment about autism and vaccines. I know that people are in pain looking at the childhood chronic disease epidemic and the rising rate of childhood neurodevelopmental diseases, and they're looking for answers. And I think that I certainly can't speak for anyone who's spoken out about vaccines and autism. However, I would assume that most people understand that health is, there's multifarious things that impact every medical condition, and are trying to understand if there's a contribution from a significant number of medications that our children are getting to this disease. I'm strongly supportive of the research that the administration is, or the grants that the administration has recently enacted, I believe for about $50 million to study root causes of autism and specifically environmental factors. And I think we should all look forward to the results of those studies, and hopefully we can help children through that.
I appreciate that, and I look forward to that science being the North Star of those investigations.
Yes.
Thank you.
Thank you.
Senator Markey.